Hi everyone, I'm Dr. Jane Yu, board certified dermatologist and Mohs surgeon. Today I want to go deeper into the different types of radiofrequency and ultrasound technologies. These treatments are commonly used for non-invasive skin tightening, collagen stimulation, and overall skin quality improvement. But not all RF and ultrasound treatments work the same way. They differ in how energy is delivered, how deeply that energy reaches, and what types of skin concerns they're best suited to treat. So let's start with radiofrequency or RF. Radiofrequency treatments all work by delivering controlled heat into the skin to stimulate collagen and elastin, but the way that energy is delivered can vary. One type is monopolar radiofrequency. Monopolar RF uses a single active electrode to deliver energy deeply into the skin, with the current traveling through the tissue towards a grounding pad placed elsewhere on the body. Because of this setup, monopolar RF is able to reach deeper layers and is often associated with more pronounced skin tightening effects. Another type is bipolar radiofrequency. Bipolar RF uses two electrodes placed close together on the skin, allowing the energy to travel between them. This limits how deeply the energy penetrates and makes bipolar RF more focused on the superficial to mid-dermal layers. This type of RF is commonly used on the face and neck, where more controlled surface level tightening is desired. Now, there's also multipolar radiofrequency, which uses multiple electrodes to distribute energy more evenly across a larger area. This allows for faster treatment sessions and more uniform heating, and is often used when treating broader areas of the face or the body. Another important category is fractional radiofrequency, which includes radiofrequency microneedling. Instead of heating the entire surface of the skin evenly, fractional RF delivers energy in a controlled, segmented way. In radiofrequency microneedling, tiny insulated needles create precise microchannels in the skin and deliver radiofrequency energy directly into the dermis while limiting heat exposure at the surface. The microneedling component creates controlled micro-injuries that activate the skin's natural wound healing response, stimulating collagen as well as elastin production. At the same time, the radiofrequency energy adds targeted heat at specific depths, which enhance collagen remodeling beyond what traditional microneedling can achieve on its own. This combination allows for precise depth control and more robust stimulation to the deeper layers of the skin. And because of this dual mechanism, radiofrequency microneedling is commonly used to improve acne scarring, fine lines, skin texture, enlarged pores, and skin laxity. Compared to microneedling alone, the addition of radiofrequency allows for deeper collagen stimulation while keeping the outer layers of the skin relatively protected. Now, let's talk about ultrasound treatments. Ultrasound is primarily used for skin lifting and tightening, especially in areas where deeper structural support plays a role, such as the brow, jawline, neck, and even chest. Unlike RF, ultrasound uses sound wave energy rather than electrical energy. Ultrasound treatments deliver focused energy to specific depths beneath the skin, and in some layers can reach the SMAS layer, which is the same foundational layer addressed during surgical facelifts. This depth targeting is what allows ultrasound to create lifting effects over time. Some ultrasound technologies use real-time imaging, which allows the provider to visualize tissue layers during treatment. This helps guide energy delivery to the intended depth while maintaining precision and safety. Now, there are also newer ultrasound platforms that can deliver energy in parallel or distributed beams rather than a single focal point. These systems are designed to create more uniform heating across the treatment zone while still targeting deeper layers involved in skin tightening. So while radiofrequency and ultrasound are often grouped together, they differ not only in the energy type, but also in delivery method, depth of penetration, and clinical applications. RF technologies vary based on electrode configuration and whether microneedling is involved, while ultrasound technologies vary based on how focused the energy is and how deeply it reaches. Understanding these differences is important because the choice of technology depends on anatomy, skin concerns, and treatment goals, not just the name of the device.